Hi, and welcome to Doctors Don't Lie. My name's Jeremy, and I'll be your host this evening. I'd like to thank everyone here who took the time from their busy schedule to be with us this evening. In this very special webinar, we invited a few of our medical experts in a special panel to discuss and share with us their clinical experience and use of GSH Complex. So let's cut straight to it, shall we? My first is Dr. Christopher J. Fabricius, a licensed primary care physician from the state of Utah with 18 years of clinical experience. He's a 1997 graduate of the oldest fully accredited naturopathic medical school in the United States at the National College of Naturopathic Medicine in Portland, Oregon. His areas of clinical expertise are upon all of the scientifically validated forms of natural medicine. Dr. Fabricius is a recognized expert in the field of German biological medicine, constitutional and terrain-based homeopathy, system informational field therapy, in which he routinely teaches to physician students alike. And this is just to name a few of his many credentials. My pleasure to have Dr. Fabricius joining us this evening. Good evening, Dr. Fabricius.
Good evening, Jeremy. Thanks for the warm welcome. Well, I am very pleased to be speaking with you tonight, and I want to thank you for taking the time because this is a subject that I'm absolutely passionate about, and it's my intention to share some great information with you that will inspire you to begin using and implementing the advantage that you have of having GSH Complex in your lives. And by all means, if you haven't yet spoken with your physicians, I would strongly encourage you to do so because the action of this product with the patients that I see routinely is profound, and it's something that I would encourage every healthcare professional to look into strongly because the effects really are dramatic, and because of the unique aspect of glutathione in the body and all of the many ways that it functions, which I won't focus on tonight. I've been asked to focus on the clinical use of glutathione in the body and how patients benefit from its use. But there is so much great biochemistry out there, and even Harper's Biochemistry, which is the classic medical textbook on biochemistry that is used in every medical school in first world nations. So it definitely does warrant taking a look at. We have to remember that glutathione is a very, very large protein. It's composed of 3 amino acids, glutamate, cysteine, and glycine. And clinical research shows that when you ingest glutathione directly, pretty much all of the studies show that it does not appreciably increase actual intracellular, that is the amount of glutathione present inside of a cell. And that's really where it counts. That's really where you need glutathione present in order to enable all the remarkable things that it does. The beautiful thing about my experience with using GSH Complex with patients is that it enables our patients to actually self-generate glutathione in an accelerated rate and specifically in all of the areas of the body where it's needed most. I have been involved in clinics where we actually do IV therapy and, do direct infusion of glutathione into the body. But I have to tell you, quite frankly, the effects that you can get from regular use of this product will match anything that you can get through IV and at a fraction of the cost. And lots more to say about that, but I will stay on topic. You have to remember that when our bodies get older, we produce less glutathione. And as we have less glutathione functioning in our bodies, ultimately we have impaired physiology, which leads to impaired metabolism, and that ultimately leads to degeneration and what we would call disease. And even beyond that, one could go so far as to say cell death. And again, lots more to say about that, but maybe for another day. What I can tell you is that the clinical use of having glutathione upregulated in your patients is profound. One of the top things that we use it for is to enable anyone with any degree of chemical toxicity to enable their body to begin naturally clearing toxins through normal routes of elimination. And that's really important. So any patients that you have with a history of chronic drug use, even if it's prescription use, a lot of people think that when we talk about chronic drug use, we're talking about illicit drugs. those two, but we also have to remember that many patients are on medications prescribed by their physicians for years to decades, and that certainly counts as a history of chronic drug use. Drug abuse, people that use acetaminophen regularly, people that are exposed to environmental toxins because of where they live or what they do or what their hobbies are. Golf, for example, is one of the most toxic games in the world. I think it is the most toxic game because you're getting exposed regularly to herbicides and insecticides and pesticides that they use to make those courses look so grand. Certainly poisoning. People who've lived on what we call the standard American diet, which is the SAD, S-A-D, standard American diet, certainly have plenty of chemical toxicity to address. It's also quite useful at helping the body to clear pent-up heavy metals. All of us get exposed to heavy metals. There's massive amounts of mercury in corn syrup, high fructose corn syrup. There's heavy metals found in makeups and soaps and solvents and off-gassing from industrial combustion. We are all inundated with heavy metals, and even molybdenum and cobalt have shown to actually be aided in clearance with using glutathione, which brings up the topic of helping people that are coming out of having done chemotherapy. Many of these chemotherapeutic agents are high in heavy metals, such as cisplatin, which uses platinum to kill cells. And it's important not only to help clear those residues out of the body after they've done what they've been put there to do, but also to help with the collateral damage that has happened to the healthy tissue after a chemotherapeutic run. So it's quintessentially important, certainly with every cancer patient, not only for the sake of clearing the metals after a conventional approach, if your patients have come to you after that, but also to upregulate the body's own ability to actually repair its DNA and RNA and reverse precancerous syndromes and actually aid your body's cells in actually fighting cancer, which has been well documented. We also use it for pulmonary diseases and disorders, asthma, COPD, cystic fibrosis, emphysema, bronchitis, among others. These all show remarkable effect clinically and in numerous studies with the use of upregulated glutathione. Anyone, too, nowadays knows somebody who has autoimmune disorders. We also know people that have allergies. These are just, different aspects of an immune system that's dysregulated. One of the beautiful things about glutathione in the body and giving the body the means to upregulate production when and where it's needed, which is what one gets when they use GSH Complex, is that it allows the body to site-specifically rebalance and optimize immune system function. There are a lot of people out there that are always talking about increasing immune system function. And that smacks of amateurism, because the reality is what we need is a well-tuned, well-balanced immune system, much like Goldilocks, not too hot, not too cold, but right at the level that we need. We don't need a rampant, overpowering strong immune system. Otherwise, we get allergies of all kinds. Otherwise, we can actually promote the development of autoimmune disorders. But what we want is a well-dialed in immune system, and glutathione certainly enables the body to accomplish that. Along that line, it certainly is useful with every patient that has autoimmune disorders such as systemic lupus or Graves' disease or Hashimoto's or ALS or any of the other ones. These all generate from the same syndrome according to the biological medical understanding of things. It just depends on which tissue type is affected. And so glutathione really has an ability to help a person not only symptomologically, but also to resolve the background disturbances behind why these problems are expressing in the first place. But on the other end of the spectrum, with weak immune systems, there's also great clinical data, and this is why I say that glutathione also helps the body to regulate immune system response. Because people that are prone to chronic infections or who have long-standing viral infections, whether it be warts or always getting colds and flus or having herpes or any of these things, it helps to upregulate the body's ability to be dynamic and adaptive to meet the body's needs. Not too hot, not too cold. That's what's really great about it. Neurological disorders and diseases are also readily addressed with glutathione. There's loads of research out there on that. such things as Parkinson's disease, Alzheimer's, even ringing in the ears, tinnitus with Meniere's disease. All of these things have had a great clinical research done and shown beneficial effects. Cardiovascular disease is something that also, many of our patients have. Heart disease, atherosclerosis, post-stroke recovery, post-MI recovery. These are things that, again, there's been tons of clinical research done showing the improvement. And I have to tell you clinically, with my experience in covering everything thus far that I've talked about with actual real people over 18 years experience and the 12 years that I've actually taught German biological medicine at 4 of the naturopathic medical schools, is that is helpful in all of these. I mean, there's direct benefit. And the beautiful thing is, we have to remember that it's always and only the body that does the healing in concert with God, the divine. We either work with the design of our bodies and augment and facilitate the feats of healing that only our bodies can do. There is no doctor or drug or surgery or herb or vitamin pill or IV drip that ever quote unquote heals us, but we can give the body the material and informational supports that the body needs in concert with the divine to accomplish feats of healing and cleansing that only it can. And when we give the body something like the ability to upregulate glutathione production, we really greatly facilitate its ability to physiologically and metabolically balance itself and put things into order and optimize healing even in grossly degenerated systems, which we would call diseases. Gastrointestinal disorders are greatly aided with the use of glutathione. Such things as inflammatory bowel syndrome, people with pancreatitis, ulcers, Crohn's disease, ulcerative colitis, all of these have been shown to have great clinical benefit of having upregulated glutathione production, as I can attest to. Interestingly enough, eye disorders and diseases, glutathione tends to be very, very high in concentration in the eye and the human body, and there's good reason for that. And when it drops, you'll tend to be more prone to eye disorders, such as cataracts and corneal ulcers. Interestingly enough, even a condition that's known as macular degeneration, for which there's really not very many good conventional options, responds well to having upregulated glutathione production. What else? Physical traumas are also useful. Any type of cut, contusion, bruise, sprain or strain, a break, overexertion, muscle pain, even for that matter, research shows traumatic brain injuries are all greatly aided by upregulated self-production of glutathione, which is exactly what the GSH complex helps the body to accomplish. So any time where there's a musculoskeletal disorder or disease, you should be considering using GSH complex, because whether we're talking about something like a connective tissue disorder or some form of rheumatism, or even classic degenerative joint disease, just wearing the tissues out, we have to remember that all metabolic and cellular cleansing and repair is greatly aided by sufficient amounts of glutathione. What else? Hormonal disorders, metabolic disorders, endocrine disorders, whether we're talking about adrenal dysregulation or thyroid dysregulation or blood sugars of any sort, high or low, whether we're talking about high diabetes or low blood sugar, hypoglycemia, these are all things that respond beautifully to enhance glutathione production. And in fact, with diabetes, a lot of the end organ damage and neuralgias are caused by massive, excessive oxidative damage that, of course, glutathione is tops in the body to address. And a lot of people, while I'm on the subject, will often think, well, do I really need this? Can I just take loads of vitamin E or vitamin C or selenium? And the answer, interestingly enough, is no, that's not enough. Those substances, which are commonly known as antioxidants, support the primary antioxidant enzymes in the body that do all of the work, that are the hardcore, battlecraft of getting the work done in the body, but they don't do the work that those enzymes do. And the top of those enzymes, by far, the absolute emperor of all, is glutathione. And so taking high amounts of vitamin C, D, A, E, selenium, all these so-called antioxidant nutrients. Hey, that's great, but it's not going to do squat if you don't have enough glutathione. And taking them does not upregulate production of glutathione. Vitamin C and E and, excuse me, vitamin C and selenium can maintain the duration or expand the lifespan of the use of glutathione as it's working in the body, but they will not induce production of it. You need to provide the body with the raw materials necessary to get that done. And the beautiful thing about how the GSH complex is put together is that not only is it providing you the 3 amino acids that you need in order to actually produce glutathione, but it's giving a complement of other proteins in isolate form that's actually going to give your body the additional means to do the cellular production and repair of cells that is induced by the glutathione that's also induced by its use. So it's a really rather ingenious formulation, to say the least. And I have never had a patient that has not tolerated it, and that's saying a lot because I work with a whole huge span of people, some that are like the princess and the pea and others who are not.
Oh, yeah, well, I would have to say thank you on the part of GSH Complex for all the diverse analogies you've shown. However, we do have some, unfortunately, some limited time here.
Understood, understood. Well, thank you.
My next guest speaker is Dr. Nicolas Jensen. Along with his wife, Dr. Sonia Jensen, they run the Divine Elements Naturopathic Family Wellness Center in Vancouver, British Columbia. A licensed naturopathic physician since 2007, Dr. Nick is a hormone balance expert with certifications in thyroid therapy, lifestyle medicine, intravenous vitamins and mineral therapy, and neural prototherapy for pain. He regularly lectures about naturopathic medicine and how to rebalance the hormonal system through targeted nutrition, lifestyle, and healthy digestion. Hi, Dr. Nick. It's a pleasure to have you with us today. As to my understanding, you've been using GSH Complex in your practice for a few months now. How did you come about to get to know the product and glutathione?
Thanks for having me here, Jeremy. A great product to implement into our programs here in our naturopathic clinic for one of the main reasons because accessibility. So glutathione, typically in our practice, we've been administering it through intravenous vitamin protocols, and it becomes a cost-benefit ratio mostly for patients. So to be able to have access to glutathione and its precursors in a really easy to use and simple program, it's been a great compliance piece for patients to be able to adhere to. So whereas glutathione week or so, glutathione or GSH complex is something that my patients can be taking every day. So it's definitely a value add for individuals being able to support those glutathione levels on a regular basis.
So tell me, what is your implication using GSH complex?
So glutathione is definitely a treatment of choice that we use in our clinic for many different ailments, whether it be cancer prevention or detoxification or general sense of well-being and optimal wellness. And often what we would do would be administering IV vitamin drips and including glutathione as part of the detox package and health support package intravenously. So the problem is that, as some of us may know, that glutathione isn't readily absorbed when taken in its purest form, so we need the precursors. And because IV therapy can get quite expensive to keep the elevated levels of glutathione, I was very happy to see that there's a product such as GSH that allows for a daily dosage of the precursors for building glutathione levels. And cysteine as one of these main precursors along with selenium. So in my practice, I've been able to use GSH for a couple months now, and the great thing is that it's something that people really understand, and they really start to get that chronic illness and optimal health and wellness coincides with remaining or keeping antioxidant levels high. And part of our consultation and education process is teaching about some of the roles of these really major important nutrients such as glutathione. So getting a daily dosage of the precursors that help to build and repair glutathione levels is something that I know I can keep my patients in a protective and a preventative state to be proactive with their health and to also treat chronic illness when it comes up. So a couple of patients that I've had an experience with using the GSH, one that comes to mind has irritable bowel syndrome and supplementation of GSH Complex. It's been something that's been really corrective for her, and to the point where she just comes back on her own and picks up her GSH Complex because she's enjoying it so much. Another patient with who's been type 1 diabetic for a good portion of her life. We've been implementing this protocol on as well, and as some of us on the call may or may not know, diabetes basically, or essentially, the type 1 levels is the dysfunctioning of cells within the pancreas that don't allow for proper blood sugar regulation. And so what happens is there's a whole lot of toxicity that builds up in these patients, and chronic illness sets in. And there's a significant correlation with actually all chronic illness and a degeneration and a dysfunctional level of glutathione. So in these chronic illness patients, GSH Complex is a fantastic precursor glutathione support tool to help repair and prevent. And this particular type, her blood sugar level went from a 12 down to anywhere from a 5 to a 7, which is fantastic. We're doing other things, but one of the main treatments is supporting this glutathione. So, I mean, across the board, as we age, there's more oxidation going on, there's more degeneration, and basically these factors set up a chronic inflammatory state, which is precursor for all illness that can present itself, from cardiovascular disease to diabetes, cancer, to autoimmune conditions, to all sorts of different things that can show up over time. And glutathione is definitely one of those pieces that decreases in these types of conditions. So only with age and the chronic oxidation process, and also the chronic degenerative process of chronic illness, we will always see a depleted level of glutathione. So to have a tool such as GSH, it's easy to take. There's a specific program for it that helps to maintain healthy levels of glutathione. It's basically future-proofing your body so that you're able to not only treat a chronic illness, but actually also prevent it as well. So that's been a real value add for our clinic and for our patients, and I'm looking forward to learning more about some of the feedback from patients who are actively using it. Yeah, so that's what gets me excited about using a product such as this.
Okay. You said that you use IV GSH. Now, this is you haven't substituted GSH Complex for the IV. You're actually using it together as a package. Am I right?
That's correct. Yeah. I mean, the reality is that IV or intravenous vitamin therapy or intravenous glutathione will get quite expensive if you're wanting to do it on a regular basis. And according to the research that I've actually looked at, you can use, or in order to match the appropriate level of precursors, you would have to take a significant more intravenous form of glutathione to actually hit what you can with precursor support. So precursor in the form of L-cysteine and selenium and some of the other cofactors that help to build and repair glutathione, you're doing possibly more for the individual by having just a regular daily dose of it, as opposed to frequent or infrequent administration of IV therapy.
Earlier, when we discussed a little bit, we had discussed a little bit about the implication in the as a means to help with degenerative eye problems. I know that was an aspect that touched you a little bit more. Can you explain a little bit about that aspect?
Yeah, I mean, this is another common issue that shows up as we get older, degeneration, and I mean, in response to diabetic retinopathy or the general macular degeneration, cataracts, and different things that show up as we get older, and our little microvessels, such as in the eye, are really susceptible to problems and chronic oxidation and inflammation. So found it quite unique to see that there's a product such as GSH that you can use in a topical form to help correct some of the damage that happens over time with low antioxidant levels and inflammation and everything else. So
well, yes.
Yeah, basically I was just going to let you know that I'm using it on one patient right now as a topical eye treatment, and I'm looking forward to hearing back from them on how things are going. But from what I'm learning from your team, that you've had a lot of success with reversing cataracts and different eye pathologies. So it's exciting to hear that.
Yes, definitely, and I actually personally look forward to seeing the results of your patient that's actually using it for that exact same problematic. So how likely are you to actually refer this product to your patients for a regular basis?
Yeah, that's a good question. I mean, in my practice, we definitely see a good portion of people in going through hormonal imbalance in life, people who are dealing with more chronic illness, and then we're seeing people who are just focusing on optimal health and wellness. So basically, glutathione is such a universally supportive product that it can be used across all these different paradigms of health and problems with health. So the viability of the product and the usability and the program or the system that's involved in using the product is very easy to implement, and like I said, it has a universality approach to not only prevention but also proactive treatment for chronic illness, but then also as a lifestyle product to help maintain and get people in. So the beautiful thing is that there's no one that I can think of that wouldn't benefit by raising and supporting glutathione levels. The world that we live in is definitely increasingly toxic, and we're constantly being bombarded by toxicity in all of the various forms and exposures. And in my clinic specifically, I do work with a lot of, as I said, hormonal imbalanced patients, and we know that rising levels of toxicity are a direct correlative problem for people experiencing hormonal imbalance. So definitely that's a big part of the application that we see as an effective treatment tool in our clinic.
Well, that actually sounds great. I can see that I would love to be able to discuss with you a bit more in detail. We will look forward to all the results from your patients. Unfortunately, right now, I believe we are running out of time, so I'm going to say thank you very much for taking the time out of your busy schedule to be with us tonight.
Well, thank you so much, Jeremy. I mean, I love talking about health and all the different ways to prevent and be proactive. So, if this helps, one or two people to, making changes in their health.
My third guest is Dr. Bruce Kaloski, a clinical hypnotherapist hailing from Southern California with over 40 years of experience in the field. He is a recognized leader in motivational psychology and personal empowerment disciplines, as well as in the professional fields of industry, sports, entertainment, and politics. Dr. Kaloski has focused solely on helping people and organizations from all walks of life reshape their personal vision of what's possible. His work has become standard reference material for life coaches, therapists, counselors, and facilitators. He has graciously accepted to talk to us about his clinical application and personal use of GSH Complex. Good evening, Dr. Bruce. It's very nice to have you with us this evening. So how did you come about learning about GSH Complex, and how do you use it in your application as a clinical hypnotherapist?
Well, Jeremy, about a year ago, I guess, I was hosting an internet-based TV program called Beat the Clock with Dr. Bruce, which was focused on all matters of health and anti-aging. And I interviewed Robert on that program and about GSH Complex, and we had an extensive interview. And I just found it fascinating. So, and I've been using it for, I guess, since that time. It was about a year ago, I'd say. Well, maybe about
Cool.
maybe 8 or 9 months, yeah. But I've been using it since then, and I've been using it. I started, of course, using it for myself, and then I saw the applications with my practice. I am by trade a clinical hypnotherapist, and I have been for over 40 years. And being having a doctorate in psychology, I know how the mind and psychological perspectives can affect the physiology of the body, and vice versa, of course. So as I was seeing people, I do an extensive clientele for weight loss, and that seems to be the most popular, besides the other things. But weight loss seems to be has always been the most popular. And I found it, and they found it very efficacious for helping people lose weight as a supplement to their regular diet. I've seen. I also do sports hypnotherapy, and I have people in the sports field who come to me and suffer from various aches and pains, and I just happen to mention this to them, and they did try it. They also found that very helpful after taking it for a couple of weeks but as I said, for various aches and pains. But I'd have to say that to me, the most important application, at least, well, probably for me and for also some of my clients, is the energy that it gives me. And by energy, I'm not necessarily talking about a frenetic or nervous type of energy. It's more of a calm, focused type of energy and sustained type of energy throughout the day. And I was very impressed by that particular fact.
So you're saying that basically a far better alternative to such things like a Red Bull or 5-minute energy then?
The caffeine-based drinks, yes, definitely, absolutely. And also, from a psychological perspective, when you feel better, you're going to perform better in almost every aspect of your life, almost every avenue of your life, if you will. I also found it helpful, and if I may interject, I see that it has applications both with inside the body and outside the body. I saw on your website that it can be used as a mask, and I had people try, and I tried it myself, and I found it very competitive and on a par with some of the more expensive dermatological or beauty items out there that are marketed as masks. That's very impressive when it can do something like that.
Okay, so you're actually referring to the transdermal applications to the GSH Complex.
Exactly. As I said, from within and without, from inside and outside the body. So I don't know. I don't know. Honestly, I don't know of any other products out there on the market that really have such an application. Yeah,
well, as we like to say, we like to hit it a double whammy on both ends.
Yeah, I believe you're absolutely doing that. Absolutely. So just to reiterate, it does have both, from my perspective and what I do, it has applications. It has applications both psychologically and physiologically. And that's
okay, because since we're addressing the looks, since we're addressing the looks, as you said, which makes you feel helps with your overall psychological state, which basically in turn helps with your health state too.
Indeed it does. So many people these days suffer from challenges to their focus and their concentration. I've just helped at that. This particular product has given me the edge on that, and also the people that I have.
Okay. So you're also looking at the psychological stress or use of the psychological stress. Let's say, well, Christmas would be something that would be good for those that have to have their whole families over, and there's always that little bit of.
Well, there's a lot. There's stress. So most people have stress of some sort daily in their lives, and the edge and taking that edge off in stressful situations, or just an overall stressful approach to life. So I think it would be a very good idea to take this during the holidays. Absolutely.
Oh, yeah. Well, we'll both be working on the stress factor, and holiday always equal the colds and flu seasons at the same time. So I guess we're going to be helping on that aspect too.
I'm sure. I understand that it does have various. We just got into the cold and flu season, of course, here in Southern California, and so I started taking about 6 or 8 months ago, and that was in between seasons. But I'll certainly make sure that I keep my shields up, so to speak. I think it's critically important. My understanding from what I've read about the ability to help the body generate glutathione, which is like the mother of all antioxidants, certainly has applicability in building the immune system, and that's so important at this time of the year, any time of the year, but particularly when we're faced with so many challenges at the cold and flu season.
Mm-hmm. Well, I couldn't have said it better myself, I guess.
Yeah.
Well, I think that's just about all the time that we can have. I mean, I'd love to be able to discuss with you a bit more in detail, especially on the psychological aspect of GSH Complex. I think the thing notion to bring about, and it's not something that you normally see with pharmaceutical or natural products. So I think that's always a great aspect to add to it.
You would know. I'd look forward to discussing this further with you folks at some time in the future. And thank you for having me. I enjoyed it.
Well, thank you for giving some time out of your busy schedule to talk to us and to everyone out there that's listening in right now. So, although my last guest this evening isn't a physician, his personal experience has become an inspiration and a great insight into the use of GSH Complex from a client's point of view. I'd like to introduce Matthieu Cameron. He's a longtime client of the use of GSH Complex. Matthieu, I hear that you have to know with the use of our therapy, namely with your grandparents. Do you want to elaborate on that with us today?
Absolutely, it would be a pleasure. Thanks for having me. So basically, I'll brief what I've experienced when I started GSH Complex at least a year ago. Within the first few days, I've noticed an increase of energy and also a lot of toxicity that was leaving my body through my bowel movements, because I've been exposed probably to many chemicals from the food or the air we breathe on a daily basis and whatsoever. And with this being said, when I left, toxicity was leaving my body, I could feel that and see from my own, I was losing weight as well. So it helped a lot personally for my physical health and mental health as well. I've noticed the sleep pattern that was better. So we all know that when we sleep better, we heal way quicker and faster in a better way. And this is the first few things I've noticed personally when I've used the product GSH Complex. And for my grandparents, I've experienced many great things. Both are 82 and 83 years old. And they've been on most of their lives, they've been on a list of prescription medication. And there weren't many things or superfoods or functional medicine, foods that I could integrate. And knowing that GSH Complex doesn't counter-interact-ceuticals, I've used GSH in their diet on a daily basis. And I've noticed right away I was able to work with her medical doctor and get her off some prescription medications and actually help her body to heal itself. One way that I've noticed GSH contributed to her health was by muscle gain. She actually had a better muscle mass that she took the product. So for me, this was already a proof that a superfood or functional food could help her heal and regain health at her age. And
wow, I get the aspect of the being the muscle mass. That's from the GSH complex where it's derived from.
Exactly. We were very satisfied with this, and I could tell that because she had lost a lot of weight within the last few months, and following her doctor, she knew right away that she needed something to clean up her system as well. And by taking her off a few meds, of the overuse of medications, now integrating functional medicines within her body, I was able to see, yes, muscle mass increase, and it was awesome. I knew she was feeling better because she wasn't complaining of her hip replacement as well as much, from the pain of her operation.
Oh, okay, and for your grandfather?
Yes, my grandfather, he's 83 years old, and he started having, or he did have a diagnostic of beginning of dementia. And for me, this was a big concern because the medication were not doing anything good, so they stopped giving him that. And I've used GSH Complex at the same time as my grandmother started, and as I saw a huge increase in energy in him, not sleeping as much as he used to during the day, because they're known to go sleep a lot and too much during the day. So it would keep him functional during the day, and he goes twice a week to the manor, and he's out there, and he's not complaining of, doesn't even have the flu, and he's not complaining of any as much as I know, he's not complaining of any aches or pains as well.
I guess the only word I can come up with is amazing. This is it's always nice to hear from firsthand from a client that's actually using the product, the advantages that it's bringing, and especially when you're seeing it in your own family. I think a lot of us can actually relate to that. Everybody has a grandfather, unfortunately, with dementia. It's pretty common right now. So we definitely want to bring that on the effects of the dementia on the body.
Exactly. So knowing that this product can actually help nourish, with all the amino acids and the vitamins and minerals, and all the complex that's the precursors of glutathione, which I've been reading most, from glutathione, and it's amazing what it actually can do. It triggers the message to your body to actually heal, or at least ameliorate, or give a better sense of living, in people who are suffering, from all sorts of disease.
And how did you actually come about to know GSH Complex? When did you first learn about our product?
When I worked in local health food store, this is when I first was introduced to Complex. This product was brought to me by the company itself, by Robert, and I'm very pleased when I met him, because when I listened to the presentation, I was amazed that finally maybe something that we could try, and a nutraceutical, a high-grade nutraceutical that would do the job, to help give health and promote health in people. And I actually had the chance to try it, So for me, for now on, I will integrate this in my regimen, my health regimen, because I think it's important to have some solid nutraceuticals that has a lot to back it up. It's very important.
I would love to be able to talk with you a bit longer, but as a final question for you, what would you say to someone who is contemplating or who's looking into our product? What would be some suggestions that you would want to try this for the first time?
Well, definitely, if people are looking into anti-aging or antioxidants, this is definitely the nutraceutical to integrate, or the natural product, because there's many out there, but glutathione or precursors, the building blocks that are not destroyed, and that are of high quality, when you absorb them, It's important, and I would recommend people giving it a try first and see for themselves. They won't be deceived. They will love this product.
Thank you very much, Mr. Cameron, for that wonderful backstory of use, and I can't thank you on your busy schedule to talk to us this evening.
My pleasure. My pleasure. It was a pleasure being here with you.
Well, thank you very much, and have yourself a great night, okay?
All right. Bye-bye.
You know, it's always a treat for me to discuss with clients on their experiences. But this just about sums up our special webinar for this evening. Unfortunately, we don't have any time to answer any questions. However, if you should have any questions for any of our guest speakers or even myself, I invite you to write and send them to info@nutraxis.com. That's info@nutrax as in Xavier, is as in Sam.com, and we'll definitely forward them for you. I would like to personally thank our guests, Dr. Fabricius, Dr. Jensen, Dr. Kaloski, and Mr. Cameron for their time, and of course, to everyone out there listening in this evening. Good night.